Hi friends, hoping well. I'm Dr. Milind. As my session INICET 2025 is approaching, so I just wanted to share with you that how can you use this last phase of your preparation. So around 40 odd days are left, and I'm sure you are all looking at how to use them effectively. So when I was writing INICET exam, at first I also felt that this exam is difficult. They will be asking very difficult questions, and maybe we will never be able to crack it. But trust me, I feel that more than need NICT is definitely doable. Yes, the number of seats, you feel at first glance the number of seats is less, but look at the number of INIs that you have now. So definitely it's a very golden chance. And I feel that if you're looking to complete your dream of getting into PG seat this year, May NICT followed by NEET PG followed by November NICT. I think this is the best chance that you have. So that is why I think you should use the best strategy for it. So first of all, what I want to say is now at this phase when you look at your notes, you feel like will I be able to cover everything? There are 19 subjects. Will I be able to do that? And should I skip something? So let me tell you one thing. You cannot skip any subject and you should not. And how can you effectively get, how can you cover everything? I'll just tell you that. First, start with the basic sciences and short subject. See, it is no more secret that AIMS INICT exam is all about your basic sciences. I have done the polls. I have, gone through the last, few year questions, and I have been doing these videos for last quite few years. And when I also gave my exam, I also found that most of the questions are actually from the basic science, because this is the foundation of your whatever branch you're going to choose. So that is what they always focus on. So once you start your revision, once you start planning these 40 days, make sure you give best time to basic sciences. Also, INI exam give a very much importance to short subjects. So your psychiatry, your radio, your ophthalmology, or your forensic medicine. So not ophthalmology, orthopedics, your forensic medicine, your derma. These are the very important subjects, and also the subject that you can get more correct. See, medicine, I'll come to it why why the short subjects are better than doing the big course. Also about the practical knowledge. So when if you have done your internship good, you'll understand in this exam why doing internship is very important. Now, what things should be kept in mind? First, about the previous year questions. See, lot has been said about previous year questions and all. I'll say at least you should do last 3 year questions. That will be 6 sessions of INI. See, trust me, a lot of people say that they did not find the repeat questions, but the topics do repeat. You'll find a lot of topics getting repeated. And what happens when you do PYQs, you read explanation around them. I remember there was a question about donor equation a few years back. So they ask about the first step, what is equation, and in the next exam they ask how to apply this equation. So if you know everything around it, when you go through the explanation, the answer becomes important. So that is what you should do, ideally 5 years, but even if you do last 3 years, that is more than important. There is also USMLE first aid book. I have talked about it a lot in my previous videos. If you have not read it, that is okay, you don't have to touch it. Don't touch anything new in this last 40 days, not even first aid. But if you have already doing it, or if you feel like everybody is doing it, just go through the charts and images of this book. That will definitely help you in exam in some way. Now, before I continue with my video, I just want to just quickly introduce you to a few topics. So a lot of classes, a lot of influencers, they have already given you the list, and yes, the list is the same. But if I just want, there are a few topics which you should not miss. Like for anatomy, a lot of sagittal and coronal sections of the brain you will be seeing in your INI exam. The cross section of the heart mediastinum, they will be giving you the city films, and they'll be asking you to identify the structures, like the esophagus, or the veins or the arteries that are rising or entering into the heart. They will be asking you that. The vessels and nerves of the abdomen, specifically, they'll take it directly from the netters. And embryology. INI embryology is always the favorite topic of INI examiners. In physiology, they will ask you about the cardiac cycle. They will ask about the nerve and muscle physiology. Fluid electrolytes, again the famous topic for your your examiners. The nephron, the structure and the function of the nephron, and few ECGs also have found their way in exam. So these topics, why I'm giving, I'm not saying that you should start reading them. Just make sure you haven't missed them in your exam. So biochemistry, I feel one of the best way to tackle biochemistry for INI is USMLE first aid. So all the charts of first aid book are very high when it comes to biochemistry. You should know the cycles. You should know the enzymes. They'll be asking for that. You should know specifically these amino acids, DNA, RNA, protein synthesis. They are asking questions from that. And the test. So what other examiners do? They directly give you the the question. They will show you the diagrams, they'll show you the charts, they'll show you the images. So you have to be thorough with them. For pharmacology, antidotes are very important when it comes to INI. Recently approved drug is again a very hot topic, very favorite topic for a lot of people. But trust me, I remember someone had told me about, there is one site where you can go and see all the new drugs. You don't have to, because there are so many drugs that get approved every year. It's very difficult to go through all of them. But what I can say that, earlier, before I never started, Jipmer was there, and Jipmer was way ahead of its time exam in a particular. If you ask me how, so they used to ask a lot of new drug related questions. So for new drugs, either you can go in the last 3 4 years of INI, or you can just see the last, when the JIPMER started, you can see the last few years papers on any new drugs that they have mentioned. So you don't have to beat your head behind new drugs, because there are not a lot of new drugs, and there is a high chance that most of your competitors won't be knowing it. So don't waste your time on that. Now, when it comes to patho, general patho is again very important and favorite for your examiners. The inheritance, the Mendelian inheritance, they'll be showing you this flow diagram, and asking you which pattern it is. And again, the Robbins images have always been the examiner's favorite. A lot of classes are directly giving, through their visual sessions, directly giving you the book, so that also you can use. Or first, I'd also have a good chunk of image from path as well. Micro, again, a very important subject for INI. They have asked about the vaccines. The parasitic cycles are also very, favorite of AIMS examiner. When you, because NEET will stop at bacteria and the viral, but AIMS is INI, they will ask about this parasite. They'll show you the cycle, and they'll ask you which parasite or what is the intermediate host, something like that. So you should be, thorough with that. Now, if I talk about miscellaneous, yes, from FMTs, they ask about a lot of questions about toxicology from INI. So why I'm telling you this topic? So if you're someone particularly targeting INI, you should not miss these topics. There were Helsinki, Tokyo, different declarations that you should know from FMTs. In skin, you should know about the sexually transmitted diseases, because they're very confusing and they ask about them. PSM biostatistics, very basic. Even if you go through again first USMLE first aid, what the basic biostatistics, what is sensitivity, specificity, odds ratio, the basic biostatic questions are asked in a AIMS exam from PSM, and that are very important. New programs you should be aware. For surgery, again, trauma is always have been favorite of AIMS examiner. This tension pneumothorax, they always ask about that. Burns, they will show you some instruments, and this is where again the importance of internship comes. For obs gynae, again, obs gynae, pediatrics, I think these anything can be asked, but these are the things which I just want to show you that you should not miss. When it comes to big subject like medicine, PSM, and surgery, see, medicine is huge. Medicine is vast. Nobody can cover the medicine. And what I feel that most of the questions that are asked in INI for medicine per se can be actually be solved by your pharma, patho, micro knowledge. PSM, there's a significant, when it comes to PSM, there's a overlap with your micro, with your pharma, with your derma, with your pedia. So I think that also can be taken care of. Surgery also has some overlapping, but the topics which I told you, and there are a lot of topics given by your classes that are also important, and you should finish them first. Don't think in these last 40 days you're going to read whole of the medicine, PSM, surgery. It is going to take a lot of time. But trust me, again, I'm saying INI, medicine, PSM, surgery, will not find a lot of questions from them. Basic sciences is the key for your success. So how to make a plan? So see your GTs, see your GT result. What are your weak subjects? If there's a basic sciences, go back to your notes, revisit your notes, revise your notes well, give more time to them, because if you don't correct your basic sciences, your rank is going to take a hit. Big four: medicine, surgery, obs, gynae, and PSM. Just do the high yield topics and high yield areas. Strong subject, keep doing whatever you are doing. You just need some revision for them. For short subject, if you're not able to go through and read all notes, just do last 3 to 5 years of PYQs, because your derma, your psychiatry, your ortho, it has not changed a lot in over the last 3 4 years. So same questions are coming again and again. You can use it for that. The sample timetable I have shown here. If you need more, a detailed sample timetable, you can write in the comment box. I can give you a detailed timetable for the next 40 days as well. This is just an overview how you can do. Just divide two subjects, start with the basic sciences again, and combine them with the short subject. So that can make, your day will be good. You don't get bored reading one subject, and you can quickly finish a lot of subject. That will give you a good confidence. Remember, you have to give 100% in 150 questions. There will be 150 questions which you will be knowing, 10 20 questions where you will be just doing tukka. Everybody does that, and that is going to fetch you a good rank. Nobody knows all 200 questions. Don't waste too much time on the questions which you absolutely have no idea about. If there is a question or there is topic that is haunting you from the last exam that you did not know, you don't have to run behind it, because examiner has to satisfy their ego and has to give some weird topics. You don't have to chase them. Lastly, Hard work will beat the talent when talent does not work hard, and that is the story of success when it comes to INI. You are just 1 month, and I would say 40 days away from the life that you have and the life that you want. If you have wounded in the last exam, if you feel the last exam was not fair, then trust me, the healed and the focused people are the most powerful and dangerous, and I'm sure you're going to break this exam. On the road to success, there are no shortcuts. There are a lot of classes, a lot of people coming out, telling you do this. I have done in 30 days. I have done in 40 days. You don't know the backstory. You don't know how much they have worked during their MBBS days, during their internship days. There's no magic. There is no shortcut to success. Use the path that has been used by most of the people. At the end of this race, not who knows more, but who remembers more will win. That is the simple funda of this race. So, how to remember more? Do your revisions effectively and use these 40 days in the best way possible. So, guys, I hope this video helped you. If you have any question, any doubt, let me know in the comment box. I wish you all the best and take care.